Welcome to the Center for Endovascular Surgery, a division of the Hyman-Newman Institute for Neurology and Neurosurgery, or as it's often called, the Inn. We're located on Manhattan's Upper West Side at Roosevelt Hospital. The neighborhood is also home to Lincoln Center for the Performing Arts, as well as other New York landmarks such as Columbus Circle and Central Park. The Center for Endovascular Surgery is world-renowned for its treatment of vascular disorders and malformations, specifically malformations of the blood vessels of the brain. In fact, many of the life-saving techniques now being used by hospitals around the world were first developed by the doctors here. But what makes the center and the Inn truly unique goes beyond the state-of-the-art technology and highly experienced staff.
We look at the individual as a full person, a person with feelings, a person with fears, a person that needs support both in the medical aspect of it, but also in the spiritual aspect of it, in the fear that one has when one comes to a hospital. So the idea or the goal is to have a multidisciplinary team that brings beyond the science, brings the holistic part of medicine.
It is this caring spirit, along with the extremely skilled medical team, that makes this center different.
Nice to see you. Same here. Come on in.
In this video, you'll learn what to expect during your stay at the Inn. But first, let's talk about your specific medical issue. Your diagnosis is a problem called an aneurysm. It's a serious but treatable medical condition. An aneurysm is a weakness in the wall of a blood vessel. In your case, that blood vessel is either in the head, brain, or neck.
Blood vessels are like hollow tubes that carry the blood within the body, and they're made of material that's elastic. In some patients, there's a weakness in that wall, and what happens is a little bubble forms out of the side of the wall, and that's called an aneurysm.
Brain or cerebral aneurysms usually occur in an artery where the blood pressure is highest. That pressure causes the artery wall to bulge or balloon out, forming the bubble.
The biggest concern with a brain aneurysm is that the bulge is a weak point. It can rupture and bleed. It can bleed either into the brain itself or into the spaces that surround the brain.
So the first symptom of an aneurysm rupturing is a sudden severe headache, and it's often described as the worst headache of your life.
A brain aneurysm does not need to rupture to cause problems. Sometimes the bulging of the aneurysm presses against nearby parts of the brain or other vital structures.
Depending on the area affected, that can cause symptoms ranging from vision problems or blindness to abnormal sensations, seizures, and even paralysis.
So another way that an aneurysm can cause problems is by the formation of blood clots within the sac. These clots can then break off and go into normal blood vessels in the brain and cause stroke-like symptoms.
Treatment for a brain aneurysm depends on a variety of factors, including the shape, size, location, and number of aneurysms. There are two main types of aneurysms: fusiform, meaning a fairly even swelling of the artery in all directions, and the much more common saccular, where a sac or pouch balloons off the side of the artery. In either case, aneurysms tend to form at a point where a blood vessel branches. While surgery may be used to treat or clip an aneurysm, there are drawbacks.
The major drawback is that you have to open the skull, so it's an invasive procedure where you need to get access from outside of the aneurysm.
That adds the risk of injuring the brain during the traditional surgical procedure. Also, many people are simply too sick for surgery. The alternative treatment, pioneered by Dr. Berenstein, is called endovascular embolization. That's a medical term meaning blocking off the aneurysm from inside the blood vessel.
And with the endovascular techniques, we come from inside the blood vessels, so it requires just a small incision in the skin over the artery.
Here's how it works. With the help of high-resolution images of the blood vessels on a bank of monitors, the doctor threads a long, thin, flexible tube called a microcatheter through an artery, usually in the groin. The microcatheter is gently guided up to the brain to the precise location of the aneurysm. Then your doctor will either inject or place something in the aneurysm to block it off. That's the embolization. This can be a liquid, such as a medical-grade glue, tiny balloon-like particles, or most commonly, metal coils. These platinum coils curl up within the aneurysm, filling it in and allowing the blood to clot inside the aneurysm. Over time, your body grows tissue over the neck of the aneurysm, sealing it off. Sometimes embolization is done in conjunction with surgery to achieve the best possible result.
What's important to remember is that every aneurysm, the same as every human, is different, and your doctor will discuss the specific treatment approach that is best for your individual case.
Now that we've explained your condition and the different treatment options, let's talk about what to expect when you come in for treatment. The entrance to Roosevelt Hospital is on 10th Avenue, between West 58th and 59th Streets. After entering the building, come directly to the 4th floor and follow the signs to Suite 4G.
Hi, welcome back.
A team of staff members will be on hand to help with the admission process.
Good, how is everybody today?
Good morning.
Good morning.
Everything is done right here for you. So the same folks you meet in the morning, the nurses and physicians, will be with you throughout the entire process.
First, it establishes a rapport and a relationship, and most importantly, it really gives trust. Trust amongst the family, the patient, and the caregivers that are caring for your child or yourself that day.
How's Sophia? How are you?
It's a big day.
Yes.
On the day of your procedure, you'll be taken to a holding area where you will be prepped for treatment. A registered professional nurse will perform a patient assessment, which may include taking your temperature, blood pressure, additional vital signs, and blood tests. You'll also receive a vital patient information folder and be asked to sign consent forms by your doctor.
The mask, and that's what puts her to sleep, right? She'll breathe in the gas.
Yeah,
and
it
then
takes
she'll go
about
to sleep.
10, 15.
Another very important person you'll speak with is the anesthesiologist. These doctors are experienced in what it takes to put you or your child to sleep safely and to assist your treating physician during the procedure.
Oh, you're such a big girl.
This skill and knowledge is especially important when the patient is a child. We recognize that children are not simply small adults.
When they come in, they're afraid, they're confused, it might be a very new environment for them, or they might be returning and actually have some memory of that they were here before. So we treat them differently, and every kid is special. We know when the children come in based upon their age, what needs they really have. So if I have a young child who might be toddler age, crayons, coloring books are available. We even have a wagon that we can bring them into the operative suite with so they can actually have a ride.
When it's time for the procedure, you'll be taken to the catheterization suite. There, you will lie on the treatment table that incorporates high-resolution 3D X-ray and fluoroscopy systems that will guide your doctors during treatment. Parents may stay with their child until they are safely asleep. This state-of-the-art complex has a control room where all aspects of your case are continually and carefully monitored. After the treatment is over, adults go to our ICU for recovery. We have a special recovery area for kids called the PICU. That stands for Pediatric Intensive Care Unit. The PICU and Adult ICU are specifically designed to care for patients who have undergone endovascular procedures. Both are staffed by highly trained professionals. At the PICU, in addition to a full-time child life specialist, we also have a professional clown to help bring a smile to our young patients and their parents. Some of our best therapists have 4 legs. Pet therapy is increasingly recognized to be beneficial for patients of all ages. These are just a few examples of how the Inn strives to make your child's hospital experience as pleasant and non-traumatic as possible.
Parents can stay with their children here, one parent in the ICU overnight. We do have some lazy boy recliners, so they're more than welcome to sleep in as well with their child and be part of the whole process.
All of the staff at the center hopes that this video has helped you understand your condition and what to expect during your stay. But you certainly have more questions. The doctors, nurses, and staff are here to answer them. Your physicians will gladly explain anything you don't understand.
Everybody's here because we want to be. This is a place where we really feel we can give quality, compassionate care that's given no other place in the world.
I had a surgery to repair an unruptured aneurysm, and the experience was wonderful. I had the surgery on Thursday. I was home by Sunday and back to work by Monday. It was painless, and I was treated with respect and dignity, and I would recommend both the surgery and the Inn.
Rebecca and Richard Smith turned to the Inn when they learned their still unborn daughter was in distress.
We were the happiest people. We were getting ready for her baby shower, and then we go for the routine exam. They're looking at the baby, we're measuring the baby, everything is happy, and then boom, they don't know what the baby has. The baby has something in her head, we're not sure what it is.
So we went online, and I read support groups, and everybody said Dr. Berenstein saved my baby's life. We actually called here, and he came home from vacation and called us immediately.
They treated us here like gold.
The staff at the center will be happy to put you in touch with families who have been through a similar experience. Or you may want to find out about our support groups that can help you through this difficult time.
We get all types of emergencies, and we have to be available. Part of the principle of this institute is that everybody receives care, no matter your ability to pay, no matter your ability to come. I don't ask about insurance, I don't ask about those things. We take the patient and we deal with the logistics later on.
But I would shout from the rooftops how wonderful they are.
You go through the experience that I had, and you realize that these doctors can do this amazing surgery, and you feel no pain, and you barely know that they've been there. So I never knew that such a thing existed, but I'm very pleased that it does.
Every case we treat is different, and the outcome in each case may also vary. We encourage you to discuss your particular case with our healthcare team, which will review in detail risks, benefits, and alternatives.